Colorado's COVID-19 outbreak is getting very real for tens of thousands of families as Denver Public Schools announced it's going to close all of its schools starting next Monday for at least 3 weeks. And there are many other districts also closing or extending spring break.
That includes Aurora, Cherry Creek, Boulder Valley, and Brighton 27J. Jeffco schools will be closed starting Monday. The district will be doing lessons online and then heading into spring break. Denver students will still have class tomorrow, but then it's only really to grab supplies and books.
9 News reporter Jennifer Meckles talked with some district leaders, Jennifer, about how this closure is going to function.
Yes. So first I want to explain that Denver Public Schools says that none of their students or staff at this point has tested positive for COVID-19. Some are undergoing testing, but this move is really, they said, about encouraging social distancing, trying to prevent this from getting really any worse at this point in our community. So this break for DPS students will start on Monday, March 16th. Families can drop in on Monday and Tuesday next week if they want to pick anything up they might need for that extended break, things like backpacks or medication at the school. Schools will be open for that, and you do not need to make an appointment. You can just drop in. Then students will be allowed to return at this point to school on Tuesday, April 7th. DPS says during this time they're going to be providing free breakfast and lunch meals to every student every single day that they're out on school during this entire break, even the students who don't normally qualify for free meals. DPS is working on a plan to offer meal pickup at 8 different locations around the district. These will be schools, and they have published that both on their website. We are putting that on our website so you can find out where. However, DPS will not be providing childcare. Superintendent Susanna Cordova said tonight she gets that's a tough one, but she says this choice is about social distancing and they will not be bringing large groups of children and adults together.
Our goal and our hope is that this is an effort that will help slow down the spread of COVID-19 and that it is the most responsible and prudent thing to do in the interest of everybody's health and safety.
During this closure, the district says they'll be taking the time to do disinfecting and cleaning of the school and restocking any of the cleaning supplies they have and that they need. And depending on what happens with this virus, of course, this closure could be potentially extended. Right now, they plan to have students coming back on April 7th. We also asked Kyle and Kim what this means for potentially summer break, what this might mean for student testing for those high school kids. All of that is still something they're trying to figure out at this point.
Yeah, no one can predict, really, to be fair. All right, thank you, Jennifer.
So let's look at today's latest in Colorado's fight against the coronavirus. There are now 49 cases of COVID-19 in Colorado. One of them is a CU Boulder employee. CU says that employee worked Monday morning at the Center for Community. CU is going to be switching to online remote learning by next week, clearing out classrooms. Denver Mayor Michael Hancock issued a local state of emergency today. The mayor is discouraging large public events, but not doing anything to prevent them. We focused a lot on testing since COVID-19 came to Colorado. Tonight, the state health department's incident commander says it is largely too late for testing to mitigate the virus. He says it's time for aggressive social distancing and time to get hospitals ready for what is coming.
In some ways, the time for testing is moving past us. I think we need to get a good understanding of what level of transmission we have in our community. But I think it's clear that it's here now. We needed testing months ago. But that time has passed. And so we really need to start moving past testing and really starting to think about aggressive social distancing and then really thinking about how we help our medical system prepare for a potential surge of patients.